There exists in nearly all indigenous cultures the story of a golden age of man, a time when men did not kill other men, men did not abuse women, leaders were valued on what they were able to do for their people, not on what they could steal for themselves and their buddies. The ubiquitous existence of these stories is documented in Steve Taylor's book, The Fall, but many other people have written about it. Richard Heinberg, Australian academic Hiram Caton, their relation. We're now living the tail end of a 6,000-year age marked by greed. What's in it for me? And screw everybody else. It permeates all aspects of Western culture, and it manifests in medicine as a subtle form of asymmetrical warfare. I am your doctor. You are my patient. I represent knowledge and authority. You represent ignorance, or you wouldn't have come to me. You pay me my fees, and I can tell you when you can stop. If you take this relationship to its ultimate logical conclusion, you get these ridiculous developments, like chemotherapy and radiation therapy and unnecessary radical surgery, which do so much damage that in the majority of cases they ensure continued income to organized medicine because of the massive problems that they create, such that ultimately the doctor is playing the role of executioner and the patient is playing the victim. Now, I realize that this is going to strike some people very offensively. But consider the following. Over the 13 years that Alpha Omega Labs was in operation prior to my imprisonment, I had not one or two, but a whole potpourri of discussions with doctors who heard about Ken Seaman and would call to place an order. They would identify themselves, and so naturally I would interject while they were ordering. Do you know that we have a practitioner's discount? As a doctor, you only need to purchase $200 to qualify. I can't tell you how many doctors said to me in some variation, oh no, I'm not buying this for my practice, I'm buying it for myself or for a family member. There's no way I'd use this in my practice. I can't risk losing my license. Now, you have to stop and consider the implication of this before you even think about questioning the veracity of what I'm telling you. What those doctors are saying, without even considering the moral hazard of their action, was this. I care about myself and my family. I'll do whatever it takes to keep them healthy. But my patients? Screw them. I'll do whatever Big Pharma wants me to do as long as I can keep my license. I have several doctors who are friends of mine who have given up their practice over the intervening years because they can't stomach anymore what Big Pharma has become, what organized medicine has become. So I do know what I'm talking about.